Lyme disease is an vector-borne disease, communicable disease. Look at this picture, shows that skin rash and mechanism of transmission, tick bites and bacteria. Detail going on. Introduction. Lyme disease is a vector-borne illness caused by the Borrelia burgdorferi bacterium, transmitted primarily through the bite of infected black-legged ticks, commonly known as deer ticks. It is the most common tick-borne illness in the United States, but it is also found in Europe and Asia. Lyme disease can affect various body systems including the skin, joints, heart and nervous system. Definition. Lyme disease is defined as a multi-system inflammatory disease caused by the Borrelia burgdorferi bacterium. It is characterized by a wide range of symptoms, most notably an expanding erythema, migrans, rash that often appears at the site of the tick bite, along with flu-like symptoms, and in later stages neurological, cardiac or joint issues. Types. 1. Localized Lyme disease, early infection that often involves the characteristic rash. 2. Disseminated Lyme disease occurs when the infection spread to other parts of the body, including the nervous system, heart or joints. 3. Late Lyme disease. This stage is marked by chronic arthritis or neurological problems that can occur months to years after the initial infection if untreated. Causes. Lyme disease is caused by Borrelia burgdorferi, a Sphaerocytobacterium. The bacteria are transmitted to human through the bites of infected black-legged ticks. The bacterium enters the bloodstream and spread to various body systems. Transmission. Ticks become infected by feeding on small mammals, especially rodents that carry the Borrelia bacterium. The ticks then transmit the bacteria to humans or other animals through their bite. Ticks usually need to be attached to the skin for 36 to 48 hours before transmission occurs. Therefore, early removal of ticks is crucial in preventing Lyme disease. Risk factors: 1. Geographical location. Living or spending time in wooded, busy area with tall grass. 2. Time of year. Ticks are most active in the warm months, spring and summer. 3. Outdoor activities. Hiking, camping, hunting or gardening in tick-borne areas increase risk. 4. Inadequate tick prevention, not using insect repellents or protective clothing while in tick infected areas. Complications: if left untreated, Lyme disease can lead to serious health issues, including 1. Neurological problems such as meningitis, Bell's palsy, or peripheral neuropathy. 2. Lyme arthritis, inflammation in large joints, especially in knees. 3. Heart issues, Lyme carditis, which can lead to arrhythmias or heart block. 4. Post-treatment Lyme disease syndrome, chronic symptoms that persist after treatment, such as fatigue, pain, and cognitive issues. Pathophysiology: after a tick bite, Borrelia burgdorferi enters the skin and multiplies locally, causing the characteristic erythema migrans rash. The bacteria can evade the host's immune system through various mechanisms such as altering its surface proteins. It then disseminates through the bloodstream to other tissues, including the nervous system, heart, joints, and muscles. The immune system's response to the bacteria, coupled with bacterial persistence, causes the inflammatory symptoms of Lyme disease. The pathophysiology of Lyme disease involves several stages that begins with the transmission of a bacteria through the tick bite and continue with the body's immunoresponse and the bacterium's dissemination throughout the body. Here is step-by-step breakdown of the process. 1. Tick bite and transmission, tick attachment, bacterial entry. 2. Local infection, days 3 to 30, multiplication at the bite site, immunous evasion. 3. Dissemination, weeks to months, bacteremia, tissue migration, host immunoresponse. 4. Systemic involvement and chronic infection, months to years, joint involvement, Lyme arthritis, neurological involvement, cardiac involvement. 5. Immunoresponse and inflammation, inflammation and tissue damage, autoimmune-like reactions. 6. Chronic symptoms post-treatment Lyme disease syndrome. Signs and symptoms. 1. Early signs 3 to 30 days after bite, arrhythmia, migraines, expanding circular rash with bull's eye appearance, flu-like symptoms, fever, chill, headache, fatigue, muscle and joint ache. 2. Later signs, week to month after bite, severe headache and neck stiffness, arthritis with severe joint pain, swelling, especially in the knees, facial palsy, loss of muscle tone on one or both sides of the face. Heart palpitations, irregular heartbeat, dizziness or shortness of breath, inflammation of the brain and spinal cord, nerve pain, numbness or tingling in the hands or feet. Diagnosis. Diagnosing Lyme disease is primarily based on clinical presentation and history of tick exposure. However, laboratory tests are used to confirm infection. 1. ELISA, enzyme linked immunosorbent assay, used to detect antibodies to Borrelia burgdorferi. 2. Western blot, often used to confirm the results of an ELISA test. 3. Polymerase chain reaction, PCR, may be used in later stages to detect bacterial DNA in joint fluid. Nursing diagnosis on acute pain related to joint inflammation. 2. Impaired physical mobility related to joint stiffness or pain. 3. Risk for infection related to immunosuppressive therapy. 4. Fatigue related to the disease process. 5. Impaired skin integrity related to erythema, migraines, rash. 6. Anxiety related to the impact of the disease on daily life. Management. 1. Early detection. Recognizing symptoms and taking a through history of tick exposure. 2. Symptoms management, pain control, anti-inflammatory measures and rest. 3. Education. Informing patients on prevention strategies, tick removal and follow-up care. Treatment. A. Antibiotic therapy. First, early stage Lyme disease is treated with oral antibiotics such as doxycycline, amoxicillin, typically for 10 to 21 days. 2. For disseminated or late stage Lyme disease, intravenous antibiotics like ceftriaxone may be required for 2 to 4 weeks. B. Supportive care for symptoms relief, including non-steroidal anti-inflammatory drugs for joint pain or corticosteroids for severe inflammation. Psychosocial medicine. Patients with Lyme disease, particularly those with PTLDS, may experience significant emotional and psychological distress due to chronic pain, fatigue and cognitive difficulties. Mental health support, including therapy or counseling, may be beneficial in managing the psychosocial impact of the disease. Prevention. 1. Avoid tick habitats. Stay on clear paths and avoid walking through high grass or woody areas. 2. Protective clothing. Wear long sleeves, pants and closed shoes, trekking pants into socks when in tick-borne areas. 3. Tick repellents. Use EPA approved insect repellents containing DEET. Treated clothing. 4. Tick checks. Regularly inspect the body for ticks, especially in head to see areas behind ears, and remove any ticks promptly using fine tipped tweezers. In conclusion, Lyme disease, although serious, can be effectively treated when diagnosed early. However, prevention is key, as early intervention keeps prevent the progression of the disease to its more severe forms. Public health measures, education on tick bite prevention and promote treatment are critical to controlling Lyme diseases. Impact on individuals and communities. Thank you. Have a nice day.